You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, what's new in minimally invasive facial rejuvenation? How to look years younger without surgery. With us, we have an expert on the topic, Dr. James Lee. Dr. Lee, welcome to the program.
Thank you. Nice to be here.
Now, we've had you on the program before.
Yes.
With your well-known wife.
Of course.
Board-certified dermatologist, America's favorite dermatologist, Dr. Tess Mauricio. So you work together.
Yes. It's always a pleasure to be with working with your wife. It's challenging at times, but it's very rewarding, and it's something that we have fun doing.
And we talked on the phone. You said, this is an exciting time in facial rejuvenation. Why? Why do you say that?
For the first time in as many years, there have been technologies to improve everything. Up until maybe 5 or 6 years ago, really nothing has been available to improve the skin. This is the time. There's new technologies. There have been limitations before in what we could do. Really, there's no limit to the.
So darker skin color, is that the biggest thing, that people with darker skin color now can take advantage of things?
The difference is that before, the stress was on the fair skin types. They were the easiest ones to treat. You could go pretty much as hard as you wanted and as invasive or as aggressive you wanted to go, and you could do it. The darker skin types are a little more sensitive. You would think that with pigmentation that you have a little more protection. It's almost the opposite, Randy.
Right.
The skin of any pigmentation whatsoever, even with my pigmentation, you're going to have more reaction to some.
So the intense pulse lights, the IPL of 3 to 5 years ago, would not have been good for your skin, because you're not that dark, really.
I have pigmentation, Randy. Anyone with pigmentation is going to absorb that energy at the surface. None of it's going to get down deep.
So olive skin people.
With any pigmentation whatsoever. Anyone that's non-Caucasian essentially has pigmentation at the surface of their skin that's going to absorb most, if not all, of the energy that you're trying to deliver to rejuvenate your skin.
So now, what? Those people, great candidates.
Now you can treat everybody, Randy. There's new radiofrequency technology that it's colorblind. It doesn't matter what. You could be purple. This technology wouldn't care.
Is that right?
Yeah, it doesn't care what color you are. It's going to penetrate and get the energy down to where you need it to go.
Okay, now just so I'm clear on what kind of procedures you do, you and your wife, Dr. Tess Mauricio, do you divide the patients? I mean, is there something you do more of than she does? Do more men go to you? What is it?
It's really patient comfort. The patients get to decide who they want to be treated by. We have myself, my wife, Dr. Mauricio, and even her sister, as a nurse that works with us. They can decide amongst the three of us. It really depends on the patient preference, really.
So what are the men coming in for?
The men are coming in for Botox, getting rid of wrinkles. They're coming in to get rid of their sunspots with the IPLs. They're looking to rejuvenate, remove some of the years with the fractional resurfacing lasers that we have. Really, it's everything, Randy.
So men are coming in. What are the age ranges, by the way?
Anywhere from late teens to, we have some patients that are in their early 80s. I mean, really, it runs the gamut.
So is it just successful people that are going in to see you?
It's the successful people. It tends to be the successful people that are looking for the results to gain that edge. Whatever it is that they're doing, whether it's at work, whether it's their social lives, they're successful in one way or another, usually.
Okay.
Yes.
Now, you do my treatments, by the way.
Yes,
Your wife used to do them, and then they pawned me over to you. And then I got to tell you the truth, I kind of like our conversation. Because you're a technical guy. I like knowing the mechanism. I like knowing how it's working, what it's doing.
And that's what I pride myself.
I love that.
That's what I pride myself in. I like to know why this works. If I can't convince myself why this is working, I'm not going to feel comfortable doing any of these procedures on somebody else.
Yeah, because I'm very skeptical. You were treating my neck, and you were saying this is going to chisel out your neck. And I have a pretty good neck, thanks to you.
You're welcome.
I was asking, the question, and let's start there. With men and women. Jowling, things like that, without liposuction. Yes. Tell me about the technology.
Well, one of the things that that's very important in a face is the jawline. For men and women especially, equally, the men need a strong angular jaw and women need a soft, rounder jaw. And it's ruined either way by the jowling, by the skin laxity and the adipose tissue that sort of accumulates over the years, and the gravity takes its toll. And there are many ways to reverse that or even remove that. Anything from non-invasive to our radiofrequency procedures to our liposuction. We can do neck liposuction and actually remove the fat with minimal downtime. So really it runs the gamut. You can do everything. And even for you, Randy, you came in, you mentioned to me you were headed to a reunion of some kind.
Big reunion.
Yeah, and you wanted to look your best. That's what people are coming in for. They have specific occasions, specific goals in mind that they want to look good for, and they need to look good for.
You know what tightened me up that day?
That's what it's for.
Now, what is this where you say that it gets better with time? That means, explain that. Help me understand that. That means you treated the area. What's going on?
Most of the technologies that we use today really depend, it's tricking your own body into doing all of the work. These technologies really trigger a cascade of rejuvenation, meaning the cells of your own body are multiplying and dividing. Fibroblasts specifically, they're the ones responsible for laying down the new collagen, which is the protein in your face, the elastin, which is what keeps everything together. The more protein and the more elastin in your skin, the younger and the tighter it's going to be.
So it lays down more collagen?
Yes.
Okay, so when you're hitting my neck or a woman's neck, right here, joweling, things like that, that tightening effect, what's going on? I mean, underneath the skin, I mean, what's happening?
There's a couple different things that happen. One analogy I like to use is the steak idea. When you throw a nice steak on a grill, the first thing that happens is it shrinks up. There is some heating with most of the technology we use. The heating does tend to denature the proteins. That's the tightening that you see. So you get an immediate tightening, which is what you saw on that day.
Yeah, you do.
When that tightening takes effect, the next thing that happens is that the fibroblasts come along, the skin cells that I'm talking about, they notice that something has changed. They try to lay down new collagen on top of that old tight collagen. So that's going to reinforce that tightening effect. And then the next time you come around, you have that whole new layer of collagen. Guess what? We're going to tighten that. So it is an additive effect. Every time you come in, it's going to get better.
So when I went in there, you did two things. Very common procedures?
Very common for procedures for men in your position where you need to be in front of the TV a lot. The no downtime procedures is what we did for you. One of them was the refirm, which is the radio frequency, the tightening, the heating that I was talking about and discussing. The other one is the IPL, which is going to even out.
Intense pulse light.
Intense pulse light, thank you. That's the one that's going to be evening out the skin tones. As you age, sun damage, what have you, you tend to bring out different colors. The browns from sun damage, the reds from the hypervascularity, those tend to come out, and we can reverse all of that to give you that nice even look that an 18-year-old has.
After the treatment, people were saying, are you wearing makeup? I mean, your skin is just flawless. I mean, it really
instant,
really did a number.
A lot of the results are instant, and it's something that is noticeable first within the first day, and then just continue to improve over the next 2 or 3 weeks as your own body is signaled to make the changes.
And now women, okay, so typical patient, women comes in, what do they say on the consult?
There are a number of different things. There are a number of different reasons that people come in, but typically someone will come in and say, well, what do you see? I just noticed that people are saying I look tired. Why? What can you point out something or help me in some area? And typically it is because their skin has a little bit gained some laxity over the years. The gravity has taken its toll. The sun has given them coloration that isn't natural. And so it's a combination of things, and really it's what's important for them. Is it the coloration, because we can take care of that? Is it the skin laxity? We can take care of that. We can do it all. So everyone comes in with different.
Earlier treatment though, much better obviously, to avoid a facelift someday?
Yes, earlier treatment is always better because collagen production, you're relying on your skin's ability to produce collagen, and that is better when you're younger than when you're older, but it's always there. If your skin can heal after a cut, you're able to produce collagen.
So there's triggers.
Yes.
The healing, to build more collagen.
Yes.
So the typical patient, I mean, who is if you had to say there's a typical patient, I guess what, women over 40?
Well, it's hard to
late 30s?
It's hard to pick a typical patient, but I would say late 30s, early 40s, female, who they just don't know what happened. They feel young inside. They feel like they're the same person, but maybe 10 years ago, over the years, some sun damage has taken effect, a little bit of skin laxity, maybe some wrinkling, and those are all very easy to take care of. The wrinkling, you can with Botox. With injections, you can take care of the nasolabial folds, the little folds right here at the corners of the nose, and IPL can take away all of the sun damage, and that would take years off of how patients look.
Now, I always get this question. They say, Randy, who should I go to for spots or minimally invasive? And of course, I'm biased. I always say, Dr. Mauricio. Maybe I should start saying Dr. Lee too, right? But what's your advice though? Because they're on every corner. They have IPL. They have these radio frequency. So what do you want them to know?
Why not? You've got to go to a specialist. Why not?